In a world where supplements are marketed as universal solutions, the truth is far more narrow. Most people do not need them, and taking them just in case can sometimes cause more harm than good. But there are specific medical situations where supplements are not only helpful, they're necessary, and in some cases life-saving. These situations are grounded in clinical evidence, diagnosed deficiencies, and careful medical monitoring. What's important is that these are the exceptions, not the norm, and they only work because the dosage, duration, and underlying need are determined by a healthcare professional rather than by guesswork or marketing hype. One of the most common evidence-based uses for supplements is treating vitamin D deficiency. Unlike general wellness trends that push high-dose vitamin D as a cure-all, real deficiency is diagnosed through a blood test, not through vague symptoms. When levels are genuinely low, doctors prescribe specific dosages, sometimes daily, sometimes weekly, based on the severity of the deficiency and the patient's overall health. The dose is precise because excessive vitamin D can lead to toxicity, dangerously high calcium levels, kidney strain, and vascular calcification. Doctors repeat blood tests over time to ensure the supplement is correcting the deficiency without overshooting, striking a careful balance that self-prescribing cannot achieve. Iron supplementation is another critical example. Iron deficiency anemia is a real medical condition, confirmed through blood work showing low ferritin, low hemoglobin, and impaired red blood cell production. When iron is prescribed, the dose is specific and monitored because too much iron is toxic, capable of damaging organs and causing long-term complications. Doctors also investigate why the deficiency happened: heavy bleeding, poor absorption, gastrointestinal disease, rather than simply masking the symptoms. Iron supplements are powerful tools in the right hands, but dangerous when taken without medical oversight because people often underestimate how easy it is to accumulate excess iron. Pregnancy is one of the clearest and most universal cases where supplements become essential. Prenatal vitamins, particularly folic acid, are not optional. They are proven to reduce the risk of neural tube defects in the developing fetus. Iron, iodine, and DHA may also be recommended depending on the mother's diet and lab results. But again, the dosing is guided by obstetricians who know that too much of certain nutrients, like vitamin A, can be teratogenic and harmful to the baby. This balance of benefit and risk is something only a clinician can manage safely. Vitamin B12 supplementation is necessary for people who follow strict vegan diets, older adults with impaired absorption, and individuals with certain gastrointestinal disorders such as pernicious anemia or post-surgical changes. B12 deficiency can cause nerve damage, memory issues, and anemia, but it is easily corrected once diagnosed. Doctors determine whether oral or injectable B12 is appropriate based on the patient's ability to absorb the vitamin, again highlighting that supplements are not one-size-fits-all. Calcium supplementation is occasionally necessary for individuals with osteoporosis or conditions that impair calcium absorption, but it is not recommended for the general public, despite heavy marketing. When calcium is prescribed, it is based on bone density scans and lab results, and the dose is calibrated to avoid kidney stones and cardiovascular strain, risks that are very real when calcium is taken without need. There are other evidence-based uses: omega-3 fatty acids for people with specific cardiovascular conditions, potassium for medically monitored electrolyte imbalances, magnesium for patients with documented deficiency due to diuretic use, and prenatal iodine to support fetal development. In each case, the supplement is used to correct a known problem, not as a vague wellness booster. The key point is that these supplements work because doctors determine the actual deficiency, the right dosage, and the right duration. They use blood tests, medical history, and symptoms to build a clear clinical picture. They monitor treatment, adjust dosing, and assess side effects. This is what makes supplementation safe and effective. When people guess, self-medicate, or follow online trends, they bypass the entire safety framework that makes supplements viable tools. And this is where the danger lies. Supplements that are necessary in small, controlled amounts can become harmful when taken casually. Vitamin D becomes toxic. Iron becomes poisonous. Calcium becomes a cardiovascular risk. Herbs become drug disruptors. The line between helpful and harmful is thin, and without medical oversight, people cross it without realizing it. So, when are supplements actually needed? When the body truly lacks something, and only after a healthcare professional verifies it through testing, explains the risk, risk-benefit balance, and determines the exact amount required. Anything outside of that framework drifts into guesswork, and guesswork with biologically active substances is never safe.